it's time for Wellness Central. It's where we explore the health and wellness topics that matter most to us. And today we're delving into an issue that affects millions of people worldwide. It's infertility. According to the World Health Organization, infertility is a global health concern with an estimated 48 million couples and 186 million individuals affected worldwide. Now, advances in reproductive science, such as assisted reproductive technologies, ART, have provided help and hope to many couples. However, as gender selection has become more accessible through procedures like pre-implantation genetic testing, it has raised ethical questions about the balance between science and societal expectations in parenthood.
So joining us to unpack these complex issues is Dr. Yusuf Haroun. You've seen him here before. He's the founder for the Love for Health organization, a renowned advocate for maternal and also reproductive health. Dr. Haroun, welcome again.
Thank you very much.
You're like the third host of this show at this point.
Thank you so much for joining us.
Always like having you here for Wellness Central.
There we go. I mean, infertility in Nigeria is it's a very touchy subject, and not many people like to talk about it. And you'd be very surprised at the people that are dealing with infertility in Nigeria. So let's talk about the primary causes of infertility in Nigeria and why the taboo to talk about it.
This is very interesting because unlike hypertension, diabetes, even premature ejaculation we discussed in previous episodes, infertility is a condition where even a village woman can diagnose on the couples. Classically, infertility is a medical condition or a disease where couples, after pleasurable, enjoyable sexual intercourse for 12 months, are unable to conceive. They are diagnosed. And even neighbors around would know, oh, we came to your wedding 1 year ago, we have not seen any baby. So
but why is it always 1 year?
That is the classical criteria to diagnose infertility. Before it was 2 years, but now it's 1 year. Even when it is above 35 years, it is 6 months. When the couple, especially the woman, is above 35 years, even the man also, it is 6 months. After 6 months, they have to see a fertility doctor.
That's interesting.
Or a medical doctor.
That's very interesting.
This is something which...
I don't know anything about, you know what I mean, like couples, you know what I mean? I've never been in such a situation.
If they are planning for it, for example, some couples might say, we are not ready to have kids. So maybe they are preventing getting pregnant, and that's not infertility. But if they are preparing for it, having constant intercourse at least 3 to 4 times a week for 12 months, for 1 year, and they are unable to get pregnant.
That's a lot of sex.
So there's that time period that's given to, well, diagnosing whether it's infertility. But then infertility in itself is not the problem. There are too many factors, so many factors that lead to infertility. So what are these many factors?
Firstly, male factor and female factor. If you ask many people, as you said, it's a taboo cultural factor, many women are blamed for infertility. Even the mothers of the son or the husband blames the wife. Oh, I want to carry my grandchild. But research has shown that even infertility is more linked to the men currently. So 40 to 50% of causes of infertility are even to the men. So when the woman is being blamed all the time for infertility, it's a misnomer, it's incorrect. The woman's case also is close to 40%, then about 10 to 12% of cases are unknown. So this is where the assisted reproductive technology comes in, like in vitro fertilization, like pre-implantation genetic diagnosis or genetic
Don't mention
testing.
too much. Let's take them one at a time. In vitro fertilization,
IVF.
We've heard about that so many times.
Yes.
What exactly is the procedure? I hear that they take your eggs and then they fertilize all
Why is it my eggs?
I'm as the only lady here.
Okay.
And then they fertilize all of them. And then there are a couple of, what do you call these laws that people are always advocating against?
Yes. Ethics.
Ethics,
and,
ethical.
medical ethics on it. So different countries have different.
Yeah.
Nigeria.
So in Nigeria, how does it play?
There's no strict law on all these.
Nigeria will hail thee.
So what exactly happens?
In the Western
the eggs are
world,
fertilized
it's
and then they're
permissible.
selected.
Yes,
And then
genetic
the rest
selection.
are-
Yes, that is where the pre-implantation, you talked about pre-implantation genetic diagnosis or genetic testing. There's a societal problem with this. Many women, even women themselves, when they have to go through that system, they would select for what? Male children.
Oh.
And that is where the cultural taboo comes. But the women themselves want it because of society. Oh, they want to have a son, so would inherit the
Well,
father's
you mean you
name.
can be that specific?
Absolutely.
Yeah, it can
Wait,
be
sorry, okay, so
specific
this is
with
new to me.
genotype.
Never heard about this?
Oh,
before?
really?
I didn't know that you can actually, but it's just the cell at that point. How do you determine? How do you
Oh, there advanced
technology
science has advanced in such an
Advanced
interesting
technology.
way. Yeah.
One of the methods they use is called sperm sorting. So in sperm sorting, you can actually know the chromosome. In a male sperm, there's usually an X chromosome, which is, now again, many people don't know that men are the ones who determine even the sex or gender of a child. It's not the woman. The society blames women for having women or boys. It's the man that determines whether the child or the baby is going to be a male or a female.
Right.
So in the male sperm, you have both the X chromosome and the Y
chromosome.
chromosome. So through pre-implantation genetic testing or sperm sorting, you can select the type of chromosome, and you can also know the you can select the genotype. You can go specific into
That's
integrity to the genetic composition even of the child.
Oh yeah, science is amazing like that. But what's very sad about that is the fact that people say it's an advanced form of femicide, where people are you know, it's that's where the ethics come in. But let's circle back to the causes of infertility, and I would like to talk about it for men. You know what I mean? Because it's never really spoken about. It's oftentimes the women, you know, but never the men.
I said male factor and female factor. Now, in the men which you have specified, male factor, one of the major causes is low sperm count. And there are many things that can cause low sperm count in men. There's another one called no sperm count at all, azospermia. The
How do
low
I know
sperm,
if I don't have a, because are there
have
signs? Are there signs? Because I mean, everything, when it shoots out now, doesn't
How
it?
do you know if you don't have?
Like, how do you know that I have a low sperm? Or what are
It's easy,
signs?
you're Judith, you're a female.
Oh, like what? Weirdo. Like, how does a man know
There you go.
that that their sperm is either of low count or there's nothing, they're shooting blanks? Because they gotta shoot
the
something.
man may not know for the rest of his life.
And so it's just shooting blanks, like his water
fact,
that's coming out. Hey,
DNA test has revealed that some men are not even the fathers because they can't even impregnate a woman. There is a story my gynecologist told me, my lecturer, Professor Fabawo, is now is one of the head top shots in Lasut. And he told us this story that there was a particular king in Nigeria who had multiple wives, and he has been shooting blanks.
Oh.
So
And he
he
has
married
plenty
a
of
new
sons and
wife.
daughters.
Yes, and she didn't get pregnant after 1 year. And she was worried, so other wives had to tell her the method. which
the
they
lives
use.
of Baba Segi's
It's
wives.
new
That's the
lives.
name. Yeah, it
This
reminds me of
happens.
yeah.
It happens a lot.
That's the book.
over the world.
The lives of Baba
How
Segi's
will
wives.
people know? Men may not know. It is asymptomatic. A man might look physically good, handsome. He might even not have erectile dysfunction, as we talked about. He might not have premature ejaculation, and he might be shooting blank. Another man can have erectile dysfunction. He might have premature. Just 1 second, he has gone in, and he might even have a good sperm to pregnate the woman.
So there are no signs?
There may be no signs. The only thing or the most important way the man may know is if he goes for tests, seminal fluid analysis, SFA. So when he goes for a sperm count test, it will show the amount. There's a certain amount that should be in his sperm. Millions should be in his sperm. So if he's having low, less than a particular number, he should know that yes, he's having low sperm count. And sometimes if they go through the microscope to see the sperm, everything might be dead. So what are the causes? One of it is mumps in teenage. Mumps, which young
How does
boys
that
have had.
relate?
It's a viral infection that destroys the testicles.
Oh.
Yes, it affects the jaw, but it goes down into the testicles and destroys it completely. So they may have no sperm count. Other things that cause it could be a trauma to the testicles. Men are advised not to put on tight pants all the time.
Sorry, guys, I have to go. I'm joking. I'm joking.
Weirdo.
I'm joking.
No, I mean, but
Driving long
seriously.
distance, infections, gonorrhea, chlamydia infections can cause infertility both in men and in women. So, mention urethral conditions, urethral stenosis, urethral atresia. There are many things that can affect a man's reproductive condition, but people don't focus on it. They focus more on women. Oh, fibroid. Oh, she's having, like, also when you talked about egg donation, the woman, if she's having good eggs, she may donate. Previously, we talked about PCOS briefly.
Yes.
If a woman is having polycystic ovarian syndrome, it's an endocrine problem. But in that case, if she's not producing good eggs, she may not be able to conceive. That can be a cause of infertility. So even when they want to do IVF, it's not her eggs. Her eggs, if a woman doesn't even have good eggs at all, it might not be her eggs that will be used.
You said something.
Are women with PCOS prone to infertility?
Yes, they are prone. And that is why we also talked of diabetes. Everything is now making sense, and diabetes could also lead to infertility. That is why when you have a patient with infertility, they are usually given anti-diabetic drug. We talked of Ozempic a time ago for weight loss, and this, but it's also an anti-diabetic
you lose
drug.
weight.
Glucophage, metformin are given. Then clomiphene citrate to induce ovulation is also given to a woman. For a man, there are testosterone drugs. Drugs that you can give a man. It can be injectable. There are some that are oral that you
So
can
there
give
is
a man.
a cure for men? Could it be said so?
Cure, yes and no.
I'm glad you're saying this because I know that there's athletes who are on testosterone and who also wear tights as well and who exercise, and they also fall under that number for those who are susceptible to low sperm count.
Now, in health, there is no absolute. We are told in medical school, never say never. You can see a man who will drink alcohol, who will smoke cigarettes, who will womanize, sleep with multiple women. This man will not have any STD. He will not have any significant heart condition. He might live till 90 or 80, and he might have children even. And another man who doesn't have all these exposure or risk factors might have. So all these I've mentioned are risk factors. It does not mean that, oh, this particular man does this, so he is going to have infertility. No. Or this woman does that. Okay, example of a woman, we've not gone to that, is one of the problem in women is if they have a damage to their uterus or womb. So we call something called Asherman syndrome. But I have seen a woman who had up to 10 abortions and she still had a beautiful family with kids. Another woman didn't have any abortion and she's having infertility. So it is not straightforward. Medicine is not straightforward. Life itself is not straightforward. You just find out we have risk factors to certain things, but it doesn't mean absolutely this person is doing this, is going to fall into that category.
I want to circle back again. You said yes and no when I asked regarding the cure for men.
Right.
Why
Why I said yes is that I've seen a patient who had low sperm count, was on testosterone, and the person eventually impregnated his wife. Why I said no is that if the person has no sperm count, it's not. Also with low sperm count, you can do IVF. That is where genetic selection comes in. You can take the sperm, look for the viable ones, get rid of dead ones, just take the viable one and implant it, fertilize the woman. You can do IVF for the woman, or you can do artificial insemination even for the woman. Artificial is maybe you get the sperm and through a syringe you put it in. That's for a man who doesn't have erection at all. So he has good sperm, but his erectile dysfunction, it can't even last for a second to even penetrate the woman. So you might get his sperm.
How do we get it?
The woman, his wife can masturbate him, or he can do it himself, get the sperm out and insert it into the woman to get her
That was a
pregnant.
rhetorical question, but thanks for answering.
Yes.
But what about habits? Judith is shaking her head. What about habits that might cause infertility?
Yes.
For both men
Bad
and women?
habits, smoking. Smoking is
Really?
a problem that can cause infertility, yes. Excessive alcohol intake, excessive fatty intake, obesity, bad habit, poor exercise. These are bad habits that could also lead to infertility. Men are advised not to drive long distance. It could be a risk factor also because they are sitting down on their chair and most likely the chair is going to be hot unless maybe they put on the cooler. And that also can damage the testicles. That can damage it.
This
Can
is
damage
just,
the eggs.
what
So
should we do now? Let's just sit down at home now.
Because I remember reading up
They
on
should
this
rest
thing.
and-
Yeah.
Okay, rest.
Right.
Not long
And take
distance.
breaks, right?
There are
Hence
some-
why you see those stop
Some
breaks
drivers that
along
go
the road.
long distance every day of their life just to make more money. Drive from
Truckers,
Lagos to
logistics
Sokoto, back.
operators. Yeah.
That's why I have those breaks on the road. Again, I'm going to come back to lifestyle choices, right? Because I feel like it's very important that we start to talk about how lifestyle play into this. We talked about driving as one of them. But what about, and a sedentary life is another. But for women, when you think about our lifestyle, age is one
factor. The older you get, the lesser your fertility chances are. And our education, our society now wants us to achieve before we get married and before we get pregnant. Yes. So now infertility is getting high in our society.
For lifestyle, what about women for lifestyle?
Women's lifestyle, for example, there are many things that could affect a woman. Number one is if a woman is not having to conceive at the right time, that could also affect her lifestyle. Averagely, if I tell you all that the best age for reproduction for a woman is between 18 to 24 years. That's the best age for her to conceive her first child. When a woman is getting to 35, it could affect her. So there are a lot of things that will have gone through. She would have had menstrual cycle for over 35 years, losing eggs every month, and this will also deplete our chances. But that does not mean a woman who is 35 or 40 cannot. Also, a woman who is engaged in, well, in Nigeria, women don't smoke like that, like in the West. In the West, women smoke, not even only tobacco, even weed, marijuana. So that could affect their fertility rate.
Vaping,
that could also affect it. Anything
Really?
Smoke, yeah, it could affect it.
Well, vaping is what do you call it? What is it? It's vapor.
It's vapor, literally.
It could affect, but that doesn't mean it's absolutely.
Yeah, well, they do have
Even
different flavors.
I'm not
even excessive
a connoisseur, but
excessive carbs. Not even apart from vaping. Okay, even taking too much soft drinks could affect your fertility.
No, doctor. No.
That is
Yeah, soft drinks. Anyway.
Excessive carbohydrate intake can affect it.
Goodness
So there's no specific thing that does
doctor, what are you saying? We can't drive.
We cannot eat rice.
drink
Cannot eat for
coffee.
too
We can't
long.
drink-
Don't
we
sit
can't
on
have-
anywhere that's hot.
No, I
Don't
didn't.
have
Put us
sedentary
inside a
life.
capsule and hang us on the
That's
wall.
sedentary life again.
I don't have sedentary
We can't even do
lifestyle.
nothing.
We have to make a balance. We can do all this. We can drive. Long distance, I mean, is driving long distance for a whole year. Some people, that's their habit. No, if you want to drive once, maybe drive to Ibadan or drive to Enugu. Once a while, maybe like this December, some people are driving home.
So
it's
doctor,
okay.
we have to round up now, but I just want people to know what they should do if they suspect or think that they might. Real quick, let's do this.
1 year, you never carry belevity, you go
Now, exactly, after 1 year and you are less than 35, you have been planning consistently to get pregnant and there's nothing, please see a fertility doctor, see a medical doctor, see a gynecologist.
Okay.
That's number one. Number two, improving your lifestyle, exercise, work out. Number three is that avoid all forms of risk factors, alcohol, smoking, cigarette, avoid excessive carbs intake, eat a balanced diet, vegetables, proteins. I'm not going to specify eat this or that, but let's live a good life and hopefully we're going to be fine.
Well, doctor, amazing stuff. Thank you so much for joining us and just having this conversation with us. We appreciate you for coming on. Well, there you have it.